It's really important for patients to see their report, to see what their breast density is, because if it is those categories of heterogeneously dense or extremely dense tissue, then those patients may warrant additional surveillance in addition to mammography. That sort of depends as well what their risk is. So risk is a completely different beast. There are many breast centers that will risk assess a patient. And if you're deemed high risk, regardless of what your breast density is, we do recommend additional surveillance in addition to mammography, typically in the form of breast MRI or ultrasound, alternating every 6 months with mammography. But if you're average risk, meaning that you're less than 20% lifetime risk for breast cancer, high risk is over 20% or above. But if you're average risk and below 20 and you have dense breasts, there are modalities that you can turn to if you want additional surveillance, such as screening ultrasound, such as a newer technology or sequence technology called abbreviated MRI or fast MRI, where it is like a breast MRI, but the sequence is truncated or shorter. We currently have abbreviated breast MRI at my practice. Our sequence to image the patient is 11 minutes. And we do this in women who are average risk with dense breasts. Again, knowledge is power. You have to know what your density is. And if you're one of those patients in this state where you're not receiving any notification, you need to, take it upon yourself to get the report to see what your density is, and then from there decide what's best for you in terms of an imaging surveillance pattern.